Hi, my name's Stephen Gunning. I'm one of the Pediatric Emergency Medicine Fellows here at Spectrum Health Helen DeVos Children's Hospital. We'd like to take you along today to show you some of the places that you'll be working here as a fellow. So here we are in the ambulance bay. Obviously, we're under the Children's Hospital right now. We have the ambulances come in, and then we kind of proceed into the emergency department here through these doors. Come on in. So here we are in the main part of the emergency department. It's split up into 3 modules. Here we are in Mod 1. This is where you spend most of your time as a fellow, as is the high acuity mod. It's made up of 12 beds. We have 2 resuscitation rooms, but all of the other rooms can also be used for resuscitation with lights monitoring and all the wall hookups that you would need. This is also where you do some of the more complex procedures and sedations up here in Mod 1. So here we're in our resuscitation bay. We have kind of all the supplies here that you would need for any resuscitation or trauma. We have a Pyxis machine right here in the room with us in case we need medications. We have our airway carts here with all the supplies that you would need. Our CMAC or gyroscope over here in the corner for difficult intubations, as well as a ventilator. And then obviously overhead lighting and plenty of space for the rest of the team to come in and help us with the resuscitation. Now we're entering what we call the fishbowl. This is where the providers sit and do all of our computer work. We are affiliated with Michigan State University, and so we'll have medical students, residents, fellows, advanced practice providers, and our attendings back here teaching and working on notes. Now we'll show you some of the spaces where you'll find all of your materials for procedures. So we have our dedicated laceration cart in this room, as well as an ENT cart, eye cart, slit lamp exam for eye exams, pelvic cart, as well as the iPad for any translation services that you may need. So here right in the emergency department, we do have some of our supplies here, portable x-ray, C-arm for ortho procedures, EKG machine, as well as ultrasound. And then our x-ray room is also here in the emergency department with us. And then just down the hall, we have the rest of our radiology suites with our CT scanner. We're now here in Mod 2. This is a 14-bed unit. This is used for more lower acuity RAS patients who we think we are able to disposition within 30 minutes. So there's a lot of high turnover back here and minor procedures that are able to be done quickly without sedation. Lastly, we're here in Mod 3, which is our last unit here in the emergency department. This is used mainly for overflow during the winter seasons when it gets busy, and usually in the evenings as well. So this is our main break room where you can find coffee at any time, water, store your lunch in the refrigerators, or just sit down with your colleagues and hang out for a second. We also have a nutrition room which has slushies mostly for patients, but also whenever you need a little pick-me-up. Here we're at one of our simulation labs here in the hospital. It has its own dedicated simulation coordinator. We do some of our simulations and mock codes here in the simulation lab, but we also do a lot of them in the emergency department to make it more of a realistic setting. We also have an off-site multidisciplinary facility that is dedicated to teaching and mock codes and training procedures for residents and fellows. There are 12 dedicated rooms for simulations and procedures, as well as 2 lecture rooms. We have a high fidelity infant, adult, and trauma man, which you'll all get your hands on. We also have practice ultrasound and practice laparoscopic procedures there as well. These are the offices of medical education. This is where we do spend some of our time, as we have a few offices dedicated to us as we do our research, finish charts, or whatever other studying that you have to do. There's also a full kitchen down here if you want to store your food. There's often free snacks, free coffee, and free water down here as well. Here at Spectrum, we have lots of good food opportunities for you. We're here at the main cafeteria where you'll find a smoothie bar, coffee bar, salad bar, sandwich bar, pretty much anything that you'd like. We also have just across the street Qdoba, Starbucks, Smash Burger, and a Zoop, all of which you can use your meal money at. We also have a children's cafeteria, which also has great Brickstone pizza, as well as salad bar and an ice cream shop. Some of the other places that you'll rotate through here as a fellow are the adult ER, which is connected to this hospital. It's on the same medical campus. The adult ER sees over 100,000 patients per year, so you get a lot of good experience in high acuity over there. On your trauma month, you also spend some time on the adult side as well as the pediatric side, obviously. And lastly, you will do 1 month of pediatric ICU here at the hospital. We have a 24-bed general medicine pediatric ICU as well as an 8-bed cardiac ICU. Thanks for coming along with us today through our children's hospital. We hope you enjoyed it, and we hope that you'll join us as part of your future training and career towards eventually getting to become a pediatric emergency medicine attending.